Hey there, Dr. Lutz here, and what we're going to do today is go through a thoracic CARs, a controlled articular rotation. And what we want to do first of all is we want to have a bit of a wider stance for this one. We also want to breathe in, irradiate, contracting our body so that we have a really good working base for our thoracic spine to move around. So what we want to do is hug and fold our arms, holding really tight. And now we want to flex forward. We're only flexing our thoracic spine, maybe a little bit of your lumbar. And now we're rotating and laterally flexing. Explore that outer range, really slow and controlled. Extending back. As far as we can, we want to keep our hips nice and stable. Extending back, laterally flexing, rotating and coming back into that flexion. So let's go the other way to our left now. We want to start by going down into flexion, rotate, laterally flex. Concentrate on just moving our thoracic spine, extending, rotating, laterally flexing, slow and controlled, and back to our flex position. So it's really important that we keep the hips separated from our thoracic spine for this one. We don't want to be bending from the hips at all when we're going into flexion. So let's do that from the side on position. Legs apart, breathing in, irradiate, folding your arms, hug nice and tightly. Then going into flexion, rotation, exploring that outer range. It's going to lateral flexion and extension here. Good, keep the hips separate from our thoracic spine. Focus on only moving that. Bending, rotating, laterally flexing, rotating, coming into flexion. Great. It's important that you move in your pain-free range for this one. Any pinching or sharpness we don't want to go into. Just pull away from that and go into your pain-free range. So this is going to help, first of all, maintain that motion and function that you do have. It's going to help us get more function and movement back to those areas of the spine. It's also going to stimulate all the senses of your joints there. Give that information to the nervous system so you have better control, coordination of movement, and spatial awareness there. So this is all the foundation that we need, these movement patterns, to have a really healthy functioning spine. So that's how you do a thoracic CARs.